gorgeous Kelly here. So she has an amazing lactation consultancy business called Milk Supply. So Kel, you offer home visits?
I do, within the Noosa Shire.
Within the Noosa Shire. So where is that to and from? Just so that clients know.
Well, really, it's like Kin, Koran. I include Yamundi because, let's be honest,
it's within the area?
It's within the area and all the way down to Coolum.
Amazing.
Yeah.
And so how do people find you, or how do people get in touch with you?
So basically, I have a Facebook page, Milk Supply Noosa.
Great.
And you can either email me through that, direct message me. I've got milksupplyNoosa@gmail.com.
Fantastic.
Or you can text. And all that information is found on those sites.
On those sites, fantastic, awesome. So look, I've worked with Kel for a couple of years now,
it's been a while.
So I'm not even quite sure how we met initially. I don't know, it sort of happened quite organically, but
so Noosa.
I know, but what I just adore about Kel, and I never hesitate to refer to her, is that she is incredibly objective. I think, unfortunately, with lactation consultants, they can be on one end of the spectrum or the other. And what I loved, one of the first things Kel said to me was fed is best. And that really resonated with me because feeding, I think, in society is perceived as this natural, and it can be beautiful thing that just happens. You just put your baby there and your baby just is going to feed and it's all going to be great and your baby's going to put on weight.
And it's all natural and beautiful and loving.
And then when things don't go that way, you then start to question yourself as a mother, and then there's all of these other sort of confounding, stressful factors that come into it. So I think Kelly, being a really highly skilled professional practitioner, but most importantly someone who's really objective, who will actually call it for what it is and say, you know what, this is what the evidence is showing, this is actually what's going on with you and your baby, these are really good options to consider. And one of those options may include, you know, bottle feeding, or may include formula feeding, or may include other things that isn't exclusively breastfeeding.
100%. And I'd just like to reiterate that, you know, clients' breastfeeding journeys, they are not my breastfeeding journey, you know, or they're not the World Health Organization's breastfeeding journey. They are individualized and unique to each and every family. So what we do is we go in, we assess things fully, and then we determine like all the options that are on the table, and then what would be the best option for them right now.
Exactly. So I think, and I personally, with my baby, saw Kel as a client when I was tearing my hair out. So I know, look, what it's like to deal with Kelly professionally, but also personally, and I just adore her. And I never hesitate to refer anyone to Kelly because I know that they're going to receive a really objective, really incredibly thorough exam and assessment. And you walk out of there, or Kelly walks out of your house, really, and you feel confident knowing, right, these are my options. You know that it's based on a really thorough objective exam and not someone's opinion or a biased, you know, thought, which unfortunately, and it's across every single field, unfortunately, in healthcare, but you can absolutely guarantee that what the advice that Kelly will give you will be really objective. But today I really wanted to dive into a topic that a lot of women experience, unfortunately, and it's mastitis. Mastitis is one of those awful things, isn't it?
It's terrible, and it makes you feel like you've been hit by a truck. So not only are you probably a little bit sore from just giving birth, you're a little bit hormonally crazy.
Normal.
And now, bam, let's add fever, pain, you've been hit by a truck.
Exactly. So I guess what actually is mastitis? Like, how do you know if you have mastitis?
So it's funny you ask, because in the literature, there's actually no real consensus on the definition of mastitis. So, you know, if the researchers can't get it right,
Yeah.
How
How
do
do
we
we know? Yeah.
So basically, long story short, it's a combination or one or the other of either inflammation
Yep.
or infection.
Sure.
So typical presentations are it's just like a really fast,
Yes. Acute.
sudden,
Yeah.
acute onset.
Yeah.
Pain like nobody's business. Sore as you're gonna feel like you've got the flu.
Yeah.
You are going to feel feverish, so you're probably going to have a temp greater than 38. And you may, but you may not, have redness in your breast.
And what do you find are sort of the precursors to mastitis? Like, there can be many, but
Yes.
what would you find professionally are the most common things that could potentially lead to you getting mastitis?
So most common thing is any kind of nipple trauma.
Yes.
Number one. So then, you've got a little cuts or trauma that then serves as a source of a potential way of bacteria getting in there.
Yeah, yeah.
Usually it's a Staph aureus bug
Yep.
that loves to get in there
Yep.
and have a bit of a party.
And I think, well, the evidence that we have access to as physios, they say that without a doubt, the most amount of nipple trauma can happen within those first couple of weeks anyway.
Yes.
When you've never had a baby attached to your boob, and then there's a baby's there, and it's just
8 to 12 times for however long.
It can be. And I think another really confusing, frustrating thing for women is they're told breastfeeding should never be painful, but
Right.
when a baby has never sucked at your nipple, it's going to be a little bit uncomfortable, I think. So
I think it should feel like a tugging,
Yes.
but it should never feel pinching, burning, biting, chewing,
any of those sorts of sensations.
any of those. It should feel a tugging, like
Yeah.
a stretching, but that's as far as it should go.
Sure. So with nipple trauma, I guess, what would be the biggest, and again this could be another topic in itself, but what would be the biggest thing that you would say actually leads to nipple trauma?
So 100% it's positioning.
Yeah.
So if we, for whatever reason, the baby's not quite latched in alignment,
Yep.
and that could be such a small change in positioning that's required. Sometimes the baby's mouths are latched on well, but then their body is rolled outwards. So then we've got this constant, malalignment.
Yeah.
So then the baby's changing the suck pressure
Yes.
on the actual nipple. So we've got that. So we just need to make sure the entire body position is correct.
Yep.
And then the other thing is the actual latch. A lot of mums and bugs really just like to go on in a neutral or even a little bit tucked position.
Yep.
Now, if anyone's ever tried to drink in
Yep.
a neutral or tucked position, give it a go.
Yeah.
It's quite tricky. So what we want to do
and accurate. Yes.
to try and get that slight extension is we want to really have the baby kind of anchor their lower lip first and then kind of come over the top of that nipple. So it will really be quite asymmetric because the lower part of the breast or the breast tissue will really be like filling their mouths.
Yes.
And then that top lip is just barely coming over the top.
Yeah.
It's a whisper.
Yeah, and I think also that the attachment, when you have no idea of what you're doing at the start, I think knowing if I am actually attached properly is a really, really important thing to know, because if you can prevent that nipple trauma in the first place, you can significantly reduce your risk of mastitis. And unfortunately, if you then get mastitis, the rate of you getting recurrent mastitis can also be heightened. Is that true?
Definitely.
Yeah.
100%.
So it can be like this unfortunate snowballing effect, and so often it comes back to that initial nipple trauma. And as Kel said, the biggest cause of nipple trauma at the start is attachment. So I think that in itself is a really, really good reason to actually see a really good lactation consultant to actually make sure that you're doing the right thing, even if you're asymptomatic, I think. Even just to get someone to check, is my baby attaching properly on both sides? Is it comfortable? Is there anything that I could be altering? And as Kel said, even when the attachment can be right, it may actually be your baby's body is just rolling slightly out. So having someone to actually assess that, to then prevent, hopefully, the nipple trauma, to then prevent the mastitis and the recurrent mastitis, I think is really, really important.
Yeah. And taking a breastfeeding class and actually doing a bit of education before birth. And I know like birth is such a huge all-consuming event, and I get that. That event will be over in quite a short amount of time, but you're going to be breastfeeding around the clock for however long you choose to. So if there's space in your current mindset to share a little space before you give birth and devote that to breastfeeding, that will really help you afterwards. Because once you unfortunately birth in the hospital, there might not be enough support or lactation consultants available. There are midwives, and then once you go home, child health nurses, but they may or may not be trained in lactation, so they might say it's all good when
it may not be.
It may not be.
Yeah. And again, I just can't stress that enough. It's just, if you can just prevent that nipple trauma at the start, and I'm speaking from experience, and that's why I keep stressing it, if you can just prevent that nipple trauma at the start, it can really, really slow down that snowballing effect of so many things that then happen after that.
That's right.
Yeah, that's really, really important.
Yeah. Now, and I do want to point out that, it might not have anything to do with the latch and the positioning. It might have something to do with the mechanics of the baby.
Sure.
And their suction, their ability to suck into their range of movement with their tongue properly. So you just want to, those things to be assessed also.
Absolutely. And then if the baby isn't effective or efficient at actually sucking, therefore the emptying capacity of your breast won't be anywhere near as good. And that comes down to another cause of mastitis, isn't it, Kelly? That milk is actually just staying still in the breast. So milk stasis is another really, really common cause of mastitis. So in that my baby's still draining my breast, but there's actually milk there left over.
Right.
Which can then also lead to mastitis.
Yeah, and so what we find is some babies, in the first few weeks, right, our milk it's just spilling over.
Yeah.
It's just pouring out of you.
Cluster feeding as well. Your boobs just have no idea what they're doing, do they? It's all over the place.
All over the shop.
Confusing for everyone.
Including your body. Like, it doesn't know what's up or what's down right now. So it just produces, like, Dolly Parton, lakes of milk in the beginning, right? Until it understands how much it should be making. Yes. And that takes several weeks.
Yeah.
For your
does
body.
that roughly happen?
8 to 12 weeks.
Sure.
They say.
Sure.
So anyway, so until that time, you can be making oodles of milk, and your baby doesn't actually need to eat, or doesn't need it, or may not even really be sucking correctly.
Yeah, right.
And it really just needs to open up and the milk pours in.
Yeah, right.
However, as your body starts to slow down and only make just the right amount,
what the baby needs,
the milk's not just going to pour anymore.
Yeah.
So, if that baby doesn't have a good suction or doesn't have that good latch or alignment, the baby may not be able to remove that milk effectively.
Yeah.
So not only, some babies might be doing okay in the first few weeks, and then they're around the 8 to 12 week mark when babies have to work for it. Then we come into that milk stasis, because mums can really, some of them can just pour it out without anything. But some mums from the beginning, if babies aren't removing milk adequately and the milk's hanging around for too long, or maybe you've got a dream baby that sleeps for like 12 hours, which is just beautiful for the psyche.
Yes.
However, for the ladies,
different story.
With that 12 hours of milk not being removed, therefore,
exactly,
we're at a higher predisposition of developing mastitis.
Yeah, absolutely. And I think that's also when babies, not even necessarily at the start, is it, when they're teething or when they're a little bit sick, or
whenever.
Like, so if you're not actually emptying fully and effectively, it unfortunately can definitely predispose you to then getting mastitis. So I guess a really common question that I get asked is, I don't actually know if I am feeling sort of relatively empty, your breasts are never completely empty. There's always going to be milk in them.
Right.
But how to actually know if there's an amount of milk left over that could potentially then lead to that milk stasis? Is there like a sensation? I guess what I say to patients is go by your comfort level of your breast.
Absolutely.
Yeah.
You know, if you haven't fed for a while or you're due to feed, then most mums will kind of feel this fullness, heaviness in their breasts. Or maybe lopsidedness, depending on, you know, if Bub's only fed from one side last time and then you start walking crooked. But, so after a good feed, that breast that's feeling full and heavy will feel light and soft.
Yes. And I think especially with where physio comes into it, what I say with people is get used to actually feeling your breasts, and it's normal to feel, you know, lumps. Glandular tissue is really, really lumpy. But if it's feeling quite tight, and especially if it's sore after feeding, and if there's an area of your breast that remains that way, that's definitely sort of reason to definitely also see an LC, but also physio can be really, really effective for that issue as well. So from an emptying capacity, I think this is where physiotherapy can be really, really effective, and definitely where I find giving my clients some really great self sort of massage techniques can be really, really effective and efficient. So to actually empty effectively, post feed, if you are feeling as if there's a bit of milk left over, are you in agreement that doing a bit of hand expressing or popping yourself on the pump to actually empty out that side if your bub's finished feeding, just to the point of feeling comfortable, is ideal or is effective?
Yeah, absolutely. We do need to be careful
of them creating oversupply.
Exactly.
So where does that actually tip over? Because that can be quite confusing, that point to, I just need to sort of take the cream off the top and just remove a little bit more so that I am comfortable, but I don't want to create an oversupply.
Correct.
So when would you be suggesting to patients to be cautious with that?
So basically the rule of thumb is if we were trying to create a stronger stimuli to our brain to make more milk, you would pump until 1 or 2 minutes after the last droplet of milk comes out.
Sure.
So if we're not trying to increase our supply, then all we're doing is pumping off or hand expressing enough off until you feel soft and comfortable, and then stop. Done.
Yes.
Done like a dinner.
Yes. Because I think that's a really, really big concern, especially with mastitis or engorgement, that you're just like, that is the last thing I want to do is actually make more milk.
Right.
But we're treating mastitis whereby potentially there's an issue of milk actually staying still, and if your baby isn't emptying fully and you're not actually feeling comfortable and soft after you feed, that's when just pumping or expressing just a little bit extra out can be really, really effective.
That's right. There's a great Maya Bowman created this great hand expression technique.
Yes.
Really, there's no real right or wrong way to do it, other than get in there whatever feels great and comfortable for you. You'll start feeling your own little bumps and lumps, and you'll start noticing, you know, you get little sprays of milk in particular in one area more so than the other. So as you start to familiarize yourself with your breast, some women find that they can, you know, empty and soften their breasts far quicker with their hands than they can a pump.
And I think that could also be another really, really good video to do actually how to hand express. Because again, I have so many clients being like, oh no, I was shown how to hand express, it was really painful, I had to tug at my nipple, nothing came out. So it is actually a skill, and it's a really, really great skill to learn, because it's really, really handy. Even say, for example, you need your baby to attach, but you're really, really full. Your baby can't a lot of the time attach if you are really, really full effectively in the early stages. So actually being able to take a bit out so it's a bit softer can be really, really...
works the treat.
Yeah, absolutely. We're getting off topic though. We can talk about this sort of stuff forever. But again, I think from a physio perspective, we can be really helpful to actually stimulate the flow, especially with that stasis, to actually break up sort of the milk a little bit, the milk that's actually still. Again, essentially sort of visualise it being stuck and quite sticky in that area where it's sort of hard and quite tender and sore. And that can even be pre-mastitis as well. So if you're finding that you are getting sort of tender hard spots post-feed during sort of your day, it may be a bit of a precursor to milk actually getting stuck in that one position.
Absolutely.
So what we do as physios is that we can actually apply an ultrasound to that area, which is pain-free, and it actually helps to almost warm and break up the area that is stagnant. And then we go through some really, really specific massage techniques to actually help stimulate the flow, and we actually utilise your lymphatic system to do that, because your lymphatics and your ductal system run really, really closely together.
They sure do.
So utilising your lymphatics, and we actually take you through some really, really easy sequences to be doing in the shower to actually stimulate your lymphatics to help stimulate that breast milk flow as well. So I think in treating mastitis and in treating blocked ducts and engorgement, and we haven't even spoken about blocked ducts and engorgement today, but I think it can be really definitely beneficial, especially if it's from a form of milk stasis, to see both a physio and an LC. But I really strongly believe professionally, but definitely personally from experience, that honestly everyone should see an LC after having a baby, because it's just, as I said at the start, even just to make sure that that attachment is right, because as we've discussed, the two primary causes of mastitis are nipple trauma and milk stasis. So if we can avoid that nipple trauma in the first place, I think that's fantastic.
That's exactly right. And you know, most cases, like 85% of cases, can be treated within those first 12 to 24 hours through effective positioning and through effective milk expulsion. So through hand massage, through pumping, through ultrasound therapies. So, you know, if after 12 to 24 hours we haven't resolved, then we do need to go the antibiotic route. But, you know, 85%, that's huge. If we can avoid antibiotics through self-management.
And again, I think what I really appreciate about Kel is that she's also, you know, from a medical background as well. So we are definitely not anti-antibiotics. There's definitely a place for antibiotics, and they are really, really critical and really, really important when you need them. But you can manage so much, as I said, 85%
is what
can actually be improved or managed without even needing to go onto that antibiotic. So,
however, I will point out, you know, by going onto the antibiotics, if we don't improve the milk removal and the positioning in the latch, then there's a good chance that we're going to slip into that cycle again and have a recurrence.
This is it.
So, moral of the story, whichever, you know, route we end up going, whether it's antibiotics, massage, ultrasound, position, you know, first and foremost we need to remove milk. That's easy. Get the milk going, and then fix the latch. And go from there. And I think also, as Kel said, around that 8 to 12 week mark, when your breasts and your body really start to familiarise with your baby and calm down, a lot of this does get better around that stage anyway. But you still can get mastitis down the track as well. Oh, absolutely. With teething, with sickness, if you know, think, oh, I'm starting to settle down, I'm going to go out and buy a really cute little bra. Which looks amazing on you, but probably maybe too tight. Get some underwire happening, and that's the pressure of the too tight bra can also...
This is it. So there are literally 1,000,001 things, not really, that's an exaggeration, but there are lots of things, I don't want to make anyone paranoid, but there are lots of things that you can inadvertently be doing that can actually be blocking and closing off how effectively that milk can be flowing. And definitely if you're wearing a bra or clothes that after you take them off you can actually see an indentation, especially in your breast, that
tight
is an indication that it is just not the right garment for you to be wearing.
At this point.
Exactly.
Exactly.
We can keep the sexy bras for possibly down the track a little bit.
That's right.
But yeah, having a really, really supportive, nurturing team behind you, I think especially in that postnatal phase, but especially if you feel like you're having difficulties with breastfeeding is just really, really important. So I know I would love to see you and help you out, but I definitely recommend that you get in touch with Kel. So her Facebook is Milk Supply Noosa.
That's correct.
So look Kel up on Facebook and her details are all there.
Yeah.
If you need her card or any information from me about Kel, we have all of her information here in clinic. But if you are worried, if you want more information about feeding and you're in the pregnancy phase, feel free to reach out to Kel as well.
Yes. There's some great classes on the coast.
Yeah.
Birth and Baby Village here in Noosaville
Great.
offers birthing classes, breastfeeding classes, and then lots of the hospitals offer some sort of class as well.
Yeah.
So there are options out there.
Yeah, fantastic.
Education is power.
Absolutely, and finding the option that suits you and suits your baby and suits your family, I think is really, really important as well. So don't hesitate to reach out, because we all know that it can be a really, really tough time. We're thinking of you all. We're giving you a big cuddle and kiss down the camera, but please don't ever hesitate to give us a call if you have any problems. Have a great day. Bye.
Bye.